Doherty, please.
Maigad Ceann Comhairle agus dúspáir a bhfuil mo chomhrón a nuil agus comhrón ar bhhairtí dahanana a bhfuair buas mar COVID-19 le tomulta nuas agus a glán agus a gairde ag teag folstin ag an am seo. I want to begin, Ceann Comhairle, by expressing my sympathies to all of those who have lost their lives to COVID-19, to those who lost a loved one, who lost a friend, who lost a neighbour as a result of this pandemic. The past number of weeks have left undoubtedly deep scars in families and in communities right across this island, and our thoughts and our prayers are all with those who have been affected. I also want to send my solidarity to those who have contracted the virus, including our party president, Mary Lou MacDonald, who is thankfully on the mend after several weeks of being very ill. We all look forward to her being back with us here very soon, and I thank the other party leaders for their words in this regard. Her words on Tuesday, Ceann Comhairle, summed up the necessity to heed the public health advice that has been issued when she said, "Stay safe, stay home, stay apart. You do not want to get this virus." Can I also, Ceann Comhairle, pay tribute to all those who have been working on the front line at this time? Doctors, our nurses, our carers, all of those working in our health sector, from cleaners to the cooks and other support staff who are absolutely playing a blinder at this very difficult time. We will forever be in their debt for the work that they are doing for all of us. I also want to pay tribute to others who are making a massive contribution, including the workers in our shops, in our supermarkets, those that are delivering products, the drivers, public transport staff and many, many more. All are doing an exemplary job in most difficult of circumstances, and they are all worthy of our praises and our thanks. There are a number of issues, important issues, that I want to raise today, myself and my colleagues, Ceann Comhairle, and I'll get to some of them in more detail when we have an opportunity in terms of the question and answer session. Before I do so, I think it's important to recognise that this House has a major part to play over the next number of weeks and months, and I want to recognise the presence of Alan Kelly here as leader of the Labour Party and congratulate him, as I did privately beforehand. Whilst there has been broad political consensus in how we deal with the crisis, there are a number of important issues of public interest that need to be teased out here in the Dáil today. On the topic of the health crisis, because that is the most pressing matter that is facing us as a nation at this time, I want to welcome the deal that's been struck between the HSE and the trade unions so that health staff can be redeployed to deal with the spread of COVID-19 in our nursing homes. That's important. But despite this, however, the fact is that there is a massive crisis in the nursing home and care home sector. We are told that 200 clusters have been identified in nursing homes and residential institutions, and that 245 people have died in care homes. That's over half the deaths in the state as a result of COVID-19 so far. 9 people died in Maryborough Centre for Psychiatry in Portlaoise at the weekend alone, and I think we can all agree that that's shocking, absolutely shocking, to see those figures in that centre, and our thoughts are with the families of all of those who are bereaved at this time. But the most regrettable thing about all of this is that the crisis in the residential care setting could be somewhat foreseen. In fairness to Nursing Home Ireland, they saw some of this happening. They introduced visitor restrictions to nursing homes off their own bat on the 4th of March. But for doing so, let's remember they were criticised by the Department of Health for moving too fast. It wasn't until 10 days later that the Department of Health gave their approval for such measures. That, Ceann Comhairle, I think is fair to say, has proved to be a monumental and fatal error for many of our most vulnerable citizens. Nursing Home Ireland has stated publicly, and I welcome to hear what the Minister has to say in this, that they made numerous requests for the Minister for Health and his officials for a meeting in the early days of this crisis, but that was not forthcoming. I think it's important that there is an acceptance here today that the decision of the Department of Health in this regard has proven to be the wrong one, and I think we need to have full clarity in relation to exactly what is happening within our care home settings, our nursing home settings, and hopefully a full report with all the information that is available can be provided to the House in that regard. In the here and now, we need to look at what we can all do to ensure that those in residential care settings are protected and cared for. That means fast-tracking the implementation of packages of measures agreed in respect of staffing and improving personal protective equipment access. A survey by Nursing Home Ireland's of their members last week showed that nearly a third, 29% of facilities, were still awaiting PPE supplies, while a quarter said that PPE that they received so far was not fit for purpose. We need to get to the core of this issue. Staff at the Maryborough Centre in Portlaoise raised concerns about PPE 2 weeks ago. There was passionate pleas for the community to respond because it wasn't forthcoming, and unfortunately we know in that centre that there are now 8 people dead. This issue needs to be addressed, and I would also like to add in my final point that Dr Jack Lambert of the Mater Hospital made a very valid point on radio earlier today on the redeployment of healthcare staff from across the healthcare system, where he said that that needs to happen today. And the question, Taoiseach, is that type of urgency going to be injected in the system to make sure that what all of us want to see is that nobody that can be protected, whether in a residential setting, acute setting, a care home setting, that all of them need to be protected in whatever way possible. So can we ensure that we have the urgency injected and that staff are deployed to these nursing home sectors as soon as possible?
Thank you,